Hello. We want to welcome you to our show today, The Community Voice. And today we have a very interesting subject on today. Today we're going to be talking about emergency management. Sometimes we don't think about things like this, but we need to be prepared in certain times and in certain seasons. So today we hope that the information that we present to you today will be helpful in some way for you. And I'm fortunate today to be sitting here with two great men. On my right here, I have Pastor James Nash of St. Paul Missionary Baptist Church in the SunnySide area. We want to thank you for being with us, Pastor Nash. And to my left, we have Mr. Charles X. White of Charity Productions, who's going to be bringing us a lot of information about emergency management. And right now, we're going to have Mr. Charles X. White tell you a little bit about Charity Productions.
Thank you for having me, and hopefully we'll
welcome.
give a lot of information out to the community. Charity Productions has been around since 1984, and we primarily work with youth, school districts, universities, and senior citizens projects. For the last 11 years, we have been focusing in on public safety and public health issues. That is a larger definition of emergency management. When you deal with emergency management, it basically falls into those two categories primarily. Public safety, public health, you have chemical threats, biological threats, and then you have man-made and natural, but it'll generally fall into those two categories.
That's good. That's good. We know that we just went through some bad times.
Yes.
With past hurricanes. As a matter of fact, we were involved in it because our activity center over in the SunnySide area, the Marcial Keys Activity Center, was one of the areas where people were housed during these times. So, we don't want to think about it, but it's information that we really do need to know about. So, can you give us a little bit more about what you're going to present to us today?
Well, let me start by just kind of framing from some data.
Okay.
In an average year in the United States, floods will cause $2 to $3 billion in damages.
Wow.
Tornadoes will leave over 100 people dead. Fires will kill more than 6,000. These emergencies occur regularly, and others are waiting to happen. There are 9,000 high-hazard dams in the country. 4 billion tons of hazardous material move through the transportation system each year. And from Port Arthur back to Houston, we have a lot of industrial complexes that's moving a lot of hazardous material. 39 states are at risk of earthquakes, 22 metropolitan areas from hurricanes. The issue is not whether governments will be required to respond to emergencies, but rather when and how frequently.
Right.
Okay.
The time to think about emergencies is before they happen.
Exactly.
And this reference comes from McCullen 1985 research material. Now, what I want to try to bring to the audience is, in this region, there has been a lot of work done on infrastructure, buildings, brick and mortar. There has not been a lot of work done on community and organizational groups that are within a given community. There are maps in Baytown, Houston, Harris County that identify a large percentage of the areas as vulnerable populated. Now, that vulnerable population could be because of crime, could be because of low flooding area, it could be because of income, it could be because of education or health.
Right.
But they've already defined areas dealing with vulnerable population. My question to the audience would be, how many neighborhoods have actually been to planning meetings to prevent and before a hurricane or a disaster? Now, one thing I want to make a delineation on, this discussion that I try to bring forward is not limited to hurricanes.
Okay. Okay.
This is a year-round process
Right.
because we go from hurricane season from June to November. Then we are in the cold season.
All right.
Then we are in a heat season.
All right.
And I think more people die by heat stroke every year than hurricanes.
Right, right.
Exactly.
So how do we mitigate the risk factors is the question. Now you have some prevailing contributing factors that compound a service delivery system to reach more people than it's currently reaching. You have a budget crunch right now, and you have limited manpower.
All right.
So automatically the question is, where would you get more help and resources from? And the answer to the question is from the neighborhood.
Right.
And there are several programs by FEMA, which we're going to be highlighting at a conference. We're hosting a conference
Oh,
in
okay.
April.
Yeah.
It's called Working Together for Readiness. This is our third conference.
All right.
And this particular conference is focused on the average citizen coming together to connect with the police department, fire department, and the health department. Now, those are the boots on the ground. That when you have a situation, however, if there was a chemical explosion a major chemical explosion in one part of the city, all of the assets and the resources are going to be transferred there. If it's any other minor or major incident, then we'll be scrambling for resources. I'll cite the Tucson incident. There's a phrase that's popularized by saying first responders.
Right.
Okay. Okay.
But there's another term and phrase that's not so popular that includes the general public. They're called on-scene responders.
Okay.
Oh, okay.
The on-scene responder was that guy that helped the congresswoman.
Okay.
Normally, 90% of any emergency, man-made or natural, there are going to be on-scene responders that's going to respond to the incident before professional responders.
Right.
Well, could I ask you a question? When you say on-scene responders, are these the people that you're talking about? When you say what can the community do to mitigate some of these risk factors, are those some of the people that you would include in helping with these situations? Those on-scene responders, getting them out, getting more. I guess what I'm trying to get, I'm trying to understand is that
Civic clubs,
okay,
homeowners associations,
exactly,
churches, neighborhood groups that are community-based organizations that are in the neighborhood, not going anywhere, been in the neighborhood, providing services. There needs to be a better linkage with those groups. With Hurricane Ike, a lot of people left town. When the people came back to town, some of them couldn't even get into their neighborhood because trees were down. There's no plan to address that.
okay.
And this is a plan and a process that could be addressed by neighborhood people.
Then I'll turn to you, Pastor, and let's just say in our area, in the SunnySide area, and you said we're not just talking about hurricanes, we're talking about any disaster. And I see what we've done in our community, and I'd like you to kind of touch on that, how we've gone out trying to clean up the neighborhood, trying to stop those things. You had your parades, in Sunnyside. You open up your activity center, the Marcial Keys Activity Center, to various groups to come in to talk about all of these things. And when you said it has to be the churches, the civic clubs. Where here's where you come in at, because you get and by the way, you all, this is my pastor, and I'm a member of St. Paul Missionary Baptist Church. We do get involved with city stuff like this. So can I get you to touch on that a little bit, Pastor, about what we do in lines of what Mr. White is saying, that how we can get involved and help and mitigate some of these risk factors?
Well, first of all, let me thank Charles for coming on the program.
Thank you.
What a lot of people don't know about Charles, he brings a well of information to the community,
Yes.
Town hall meetings, through civic club meetings, and he's very, very important in the community in that he does research. When Charles brings things to the community, it's based upon stuff that he researched. And what I want Charles to do is tell us this. Now let me say this before I say anything else. Charles probably has one of the most well-attended community breakfasts in the city or in the state. And he brings a lot of people in to bring information into the people in the community. And what I like to see happen more is the pastors in the communities get more involved in the civic club activities, because that's one way that we can get the community people that never attend in the meetings to understand what it is that they need to do to prepare for hurricanes and other disasters. And certainly Charles hit on, he said hurricanes are not the only disaster we face, because there's so much crime in the community. And Charles, I don't want to take up a lot of time because I want him here because he has a lot of information to present to us, the viewers out there, and I want the viewers to understand that Charles is very, very active in the community.
Exactly.
He does things that he doesn't get paid for. He brings information back to the people. And what I want the people to hear today is how can they get the information when they don't make these civic club meetings and the town hall meetings? Tell us that, Charles. Tell the viewers that.
Well, one site I would recommend in this whole process is FEMA's site. Okay. FEMA has made a process available to a neighborhood, a church, the private businessman, the private sector, community-based organization, non-governmental organization. Let me kind of bridge it like this. There's a presidential directive, and you can look this up on the internet. Presidential directive number 5 and number 8.
Okay.
These were two major directives after 9/11. And it ushered in what's called the National Incident Management System and the National Preparedness Framework that the United States has adopted. The United States has adopted a process that will improve mitigating risk factors at all levels. And school districts, universities, hospitals, city, county, state, all of the agencies are required to go through a specific curriculum and course with exercises and training. Now, it is also available for the community.
Okay.
That's what the community is not aware of. They are not aware that they can get this training, and largely the training is free. And this is the process that we are promoting at the conference in April.
Right. Okay.
That will connect you closer in a response, in a preventive way, and a recovery way through your fire department, health department, and police department. Those connections do not exist currently. So if we can show a police department how you can get an increased number of citizens participating and mitigating risk factors in a given neighborhood, it's going to make the police's job easier.
Right.
Yes.
Same thing with fire, same thing with health. So this is the crux of the conference, is to let's get more citizens trained in this national framework that the police and fire are already trained in. The only group that's untrained and unfamiliar with it are the citizens, and the citizens can be because it's part of the federal protocol. Now, there's one other piece.
Okay.
As a part of Presidential Directive number 8, there's a what's called National Priority 4.8. You can look all this up on the internet.
All right.
And in that, this is a statement that was first provided by the first Homeland Security Director, Tom Ridge. And it's been adopted all the way for presidents, including President Obama. In this Presidential National Priority 4.8, it is clearly stated that citizens, two things that come out of this.
Okay.
One, it's not enough manpower in government.
Okay.
to address whatever the man-made or natural disaster is.
Right.
So that's a foregone conclusion.
Right. Okay.
They don't have enough manpower.
Okay.
So the people don't need to be waiting on the government when there are some tools that the community can do
Exactly.
without waiting on
Exactly.
the government.
Of course.
Exactly.
Right. Uh-huh.
I visited